As health officials in Congo begin rolling out an Ebola vaccination campaign, researchers in La Jolla are studying samples from survivors of the last Ebola outbreak 4 years ago. They're seeking broader vaccines and treatments that would also work on other strains of the highly contagious disease.
The worry is that there are actually 4 other viruses in that genus, and even more in the larger family, and they all cause disease that look like Ebola virus. We don't know which one will break out next.
Erica Ullman-Sapphire is a professor at Scripps Research Institute, where she works in a lab named after her. She also directs a consortium of the world's top Ebola researchers from 43 labs on 5 continents. She says figuring out what antibodies an Ebola survivor made in response to the infection is key in treating new infections.
These are everything we've measured about the antibody. Every spot is a different variable.
Her team of researchers dressed in lab coats are mapping the virus's molecules. She says if you know how they're built, you can figure out how to defeat them.
What we're doing here in San Diego is looking at the molecular nature of the virus. We take pictures of its key molecules to understand where it's vulnerable and where we might target a therapy.
She says think of it like military intelligence photos.
So when our military intelligence has photos that tell us what chair in what room in what house to target, because that's where the bad guy is sitting. That's what we're trying to do for this virus, to figure out exactly where we'd want to hit it with a vaccine or a therapeutic.
Ullman-Sapphire says she's not surprised that there's another Ebola outbreak because the virus circulates frequently and quietly, and she says there's evidence of many people being exposed to Ebola but not getting sick.
And so we need to track these people now to figure out where the virus is, how they're getting exposed, how these people are not getting sick, because there's something particular about their immune system or their exposure. And we need to understand more about the biology of this virus so that we can prevent an outbreak instead of always trying to put out a fire.
She's hopeful the outbreak will be knocked down quickly with the vaccine, but she says there are still concerns.
The danger is that new cases have emerged in a city of 1 million people.
For Ullman-Sapphire and her team, the Congo outbreak and the potential of other deadly related viral outbreaks has brought a renewed urgency to find a cure. Susan Murphy, KPBS News.